If you're over 70 or you have a parent, partner, or loved one who is, this video could save a license, prevent stress, and stop unexpected surprises from the Roads Authority. Because in 2026, driver license medical reviews for Australians aged 70 and over are changing, and many people won't realize it until a letter arrives in the mail or their renewal is suddenly delayed. Today, I'm breaking down exactly what's new, what hasn't changed, what doctors are now required to report, and what you must do to keep driving legally and confidently in Australia after 70. Stay with me, because one missed step could mean losing your license temporarily or even permanently, and most people don't find out until it's too late. Welcome back to Centrelink Compass AU, your trusted guide for Australian rules, updates, and changes that directly affect seniors, pensioners, and everyday Australians. If this is your first time here, make sure you subscribe, because we break down complex government rules in simple, clear language without the confusion or fear-mongering you see elsewhere. Now let's clear something up straight away. Turning 70 does not mean you automatically lose your driver license. That's a myth. Australia does not have a mandatory age cutoff for driving. What changes is how your fitness to drive is assessed. And in 2026, those assessments are being taken more seriously across all states and territories. Once you hit 70, most states require regular medical reviews to confirm you're still medically fit to drive. These reviews aren't designed to take your license away. They exist to keep you safe, protect other road users, and ensure that medical conditions are being properly managed. But here's the important part. The process, the frequency, and the consequences of medical reviews vary depending on where you live, and recent updates have made the rules stricter in some areas and more detailed in others. Let's talk about what a driver license medical review actually is. A medical review is an assessment carried out by your GP or specialist to determine whether any health condition could affect your ability to drive safely. This includes physical conditions, cognitive conditions, vision issues, and certain medications. In 2026, the focus has shifted more toward early detection rather than waiting for a serious incident to occur. For many Australians aged 70 to 74, the first medical review happens at license renewal. In some states, this is annual. In others, it may be every 2 years initially, then annually after a certain age. From age 75 onwards, most states require yearly medical assessments. From age 85, additional testing, such as on-road driving assessments, may be introduced depending on your state and your medical history. Now, here's where the 2026 updates matter. Doctors are being given clearer guidance on what must be reported and what cannot be ignored. Conditions that were previously assessed informally are now subject to stricter reporting standards. That doesn't mean more licenses will automatically be canceled, but it does mean fewer conditions will slip through unnoticed. One of the biggest areas of focus is vision. Vision standards for drivers over 70 have not changed dramatically, but enforcement has. Doctors are now expected to test not just basic eyesight, but functional vision. That includes depth perception, peripheral vision, and the ability to adapt to light changes. Cataracts, macular degeneration, and glaucoma are all under closer scrutiny. If these conditions are stable and managed, most drivers can continue driving. If they are untreated or rapidly worsening, temporary restrictions may apply. Cognitive health is another major focus in 2026. Conditions such as early dementia, mild cognitive impairment, and neurological disorders are being assessed more carefully. Importantly, a diagnosis alone does not automatically mean you lose your license. What matters is functional ability. Can you concentrate? Can you process information quickly enough? Can you make safe decisions in traffic? In many cases, drivers with early stage conditions may be allowed to continue driving with conditions such as daytime only driving or limited distance from home. Physical health is also part of the equation. Arthritis, reduced mobility, and slower reaction times are common as we age. The key question doctors ask is whether you can safely control the vehicle. Can you turn your head to check blind spots? Can you brake quickly in an emergency? Can you operate pedals without difficulty? In 2026, adaptive driving aids are being more widely recognized. This means that instead of losing your license, you may be approved to drive with modifications such as steering wheel aids or pedal adjustments. Now let's talk about medications, because this catches many seniors off guard. Certain medications, especially those for pain, anxiety, sleep, or blood pressure, can affect alertness and reaction time. In 2026, doctors are expected to actively consider medication side effects during licensed medical reviews. If you're prescribed something new, your GP may temporarily restrict your driving until your body adjusts. This is not a punishment, it's a safety measure. Once the medication stabilizes, many drivers are cleared again. Another important update is the increased use of conditional licenses. Instead of a simple yes or no, licensing authorities are now more likely to issue licenses with conditions. This might include driving only during daylight hours, staying within a certain distance from home, avoiding highways, or requiring regular medical follow-ups. For many drivers over 70, a conditional license is the reason they can keep driving instead of losing their license entirely. Let's go state by state briefly, because this is where confusion often happens. In New South Wales, drivers must have a medical assessment every year from age 75. From age 85, an on-road driving test or medical assessment is required annually. In Victoria, drivers aged 75 and over must provide a medical report if requested, and from age 85, more frequent assessments may apply. Queensland requires annual medical certificates from age 75. Western Australia has medical reviews from age 80. South Australia, Tasmania, the ACT, and the Northern Territory all have their own versions of these rules. The common theme in 2026 is consistency. Authorities are aligning standards more closely, even though the age thresholds still differ. One of the biggest mistakes seniors make is waiting for a reminder letter. In 2026, delays in medical reporting are one of the top reasons licenses are suspended. If your medical review is due and the form isn't submitted on time, your license can be paused automatically. That doesn't mean it's canceled, but it does mean you cannot legally drive until it's resolved. Always book your GP appointment well before your renewal date. Another mistake is assuming your doctor will automatically send the report. In many cases, it's your responsibility to submit the medical certificate to the licensing authority. Always confirm this. Keep copies, follow up. A simple oversight can cost weeks or months of driving privileges. Let's talk honestly about the emotional side of this. For many Australians, driving represents independence. Losing a license can feel like losing freedom. The 2026 updates acknowledge this, which is why the focus is shifting toward support rather than punishment. Doctors are encouraged to work with patients, not against them. Licensing bodies are offering more conditional options. Community transport alternatives are being expanded. This is about safety, not age discrimination. If your doctor raises concerns, don't panic. Ask questions. Ask whether restrictions are temporary. Ask what you can do to improve your chances of continuing to drive. In some cases, addressing a medical issue, adjusting medication, or completing a driving refresher course can make a significant difference. Driving refresher courses are another area gaining attention in 2026. While not mandatory in most states, completing a senior driver refresher course can demonstrate commitment to safety and help reassure doctors and assessors. These courses focus on modern road rules, hazard perception, and confidence behind the wheel. Family conversations are also important. If you have aging parents who drive, talk openly and respectfully. Offer support rather than criticism. Sometimes family input is considered during medical reviews, especially if there are safety concerns. Approach these conversations with empathy, not fear. Now let's address a big concern. Can your doctor report you without your consent? In Australia, doctors have a duty of care. If they believe a patient poses a serious risk on the road and refuses to stop driving, they may be required to notify the licensing authority. This is rare and usually a last resort. In most cases, doctors prefer cooperation and transparency. Being honest about symptoms is always better than hiding them. Another 2026 update involves digital reporting. More states are moving toward online submission of medical reviews. This can speed up processing, but also means errors can happen faster. Double check everything before submission. Incorrect information can trigger unnecessary reviews or delays. If your license is suspended following a medical review, you usually have the right to appeal or request reassessment. This may involve a specialist report or an on-road test. Don't assume suspension is permanent. Many drivers regain their license once additional information is provided. It's also important to know that holding a license without driving is still an option. Some seniors choose to keep their license active for identification or emergencies, even if they drive less often. Discuss this with your licensing authority if you're unsure. For pensioners, losing a license can affect daily life, but does not directly affect Centrelink payments. However, it can impact your ability to attend appointments, medical visits, and community activities. Planning ahead is key. So what should you do right now if you're over 70? First, check your state's specific requirements. Second, book regular GP appointments and keep your medical conditions well managed. Third, respond promptly to any letters from your licensing authority. Fourth, don't ignore small changes in health that could affect driving. Early action often means better outcomes. At Centrelink Compass AU, our goal is to give you clarity, confidence, and control. These 2026 updates are not about taking away independence. They're about making sure Australians can stay safe on the road for as long as possible. If you found this video helpful, give it a like so it reaches more Australians who need this information. Subscribe to Centrelink Compass AU for weekly updates on licenses, Centrelink, pensions, and senior-focused rule changes. And let me know in the comments, are you over 70 and still driving, or are you helping a family member navigate these changes? Your experience could help someone else. Driving after 70 in Australia is absolutely possible. With the right information, honest medical support, and a proactive approach, many seniors continue driving safely well into their later years. Stay informed, stay confident, and stay safe on the road. Thanks for watching, and I'll see you in the next update right here on Centrelink Compass AU.